A very good morning to one and all. Myself, Dr. Rahul Singh. Today I am going to present a case of serofibrinous pneumonia and concurrent hydatidosis in a Vrindavani cattle pool. Now, coming on to the case details, a adult cattle of 3 to 4 year old was presented for the necropsy at the necropsy facility in the ICRI from the cattle and buffalo farm of the university. So the date and time of the death was reported 16 April 2024 in the morning, and the postmortem was conducted in the morning itself at the 11 a.m. Now, coming on to the brief history, the animal number 322V had slipped accidentally on the 14th floor, and after the slipping, the bull was unable to stand and it became recumbent. And due to recumbency, the bull also started to develop the bloat and the tympani, and the anorexia was prominent, and the animal was unable to eat. And the animal was treated since the day of the slipping, but ultimately died on the 16th of the April 2024. Now, coming on to the external examination, the rigor mortis was present in the hind legs, and the nutritional status of the animal was fair, which was indicated by the small amount of the fat present in the subcut tissue, and the condition of the carcass was also fair. This subcutaneous fat was found to be very much less in amount, and it was gelatinized. And there were fly larvae that were lying in the oral cavity as well as in the high orbital cavity. And there was one wound that was found just above the middle claw of the right hind leg, and the size of the wound was 5 to 7 centimeter. A sterile swab was taken from the wound. Now, on internal examination, the right cranial, right middle, left cranial, and accessory lobes or the intermediate lobe, they were showing dark to red areas of the consolidation, and diffuse edema was present throughout the lungs. The bronchi, they were filled with mild froth. Now, and the liver, it contained multiple small size hydrated cysts that is indicated in the right side picture and encircled in the red oval shaped structure. And one large hydrated cyst was also present, and the gallbladder was found to be highly distended. So, multiple small size hydrated cysts and one large hydrated cyst whose size was around 5 into 7 centimeter. They were extracted or dissected from the liver parenchyma and be further processed. And on the internal examination of the kidneys, the right kidney had multiple dull brownish hard calculus or the stones of the variable size that were lying in the renal calyces. And the heart contained 15 to 20 ml of the pericardial fluid, and mild rounding of the cardiac apex was also seen along with the gelatinization of the epicardial fat that is evident in second picture. And on examination of the GIT, the jejunal mucosa was found to be highly congested as indicated in the second picture on the right side, and the lumen also had the mucoid content. The spleen was shrunken and was taken for the histopathological examination. And on histopathological examination of all the taken tissues, the lungs were found to be severely edematous and blood vessels were highly congested, and the lungs had the peribronchial lymphocytic infiltration and diffuse edema was present. And the the bronchiole were also found to be containing inflammatory exudate and the congested blood vessels in the parenchyma. The alveolar spaces, they were diffusely filled with the fibrinous exudate as well as the serous exudate, and the thickening of the interalveolar septa was clearly evident, indicating the severe pneumonia. And on histopathological examination of respiratory lymph node, severe necrotic follicles of the respiratory lymph nodes and as well as the diffuse cortical and subcortical hemorrhages, they were found. And in the spleen, severe depletion of the lymphocytic tissue was found, and blood vessels were greatly engorged and congested. And in the liver, the histopathological examination revealed bile duct proliferation and lymphocytic infiltration along with the dilatation of the sinusoidal space. And in the liver, the multiple cysts were present. So the histopathological examination also revealed the disintegrating cyst that was invading the portal vein, and that was the reason for the finding multiple number of the hydrated cysts throughout the liver parenchyma, because this one invading cyst, it was releasing the protospolacesis and it was spreading throughout the parenchyma of the liver. And due to this multiple hydatidosis and one large pressure atrophy and necrosis of the hepatocytes was present along the border, which is evident in the second picture. And the histopathological examination of heart revealed the cardiac muscles were having multiple aggregates of the sarcocystic species bradyzoids. And the kidney shows degeneration and hyalinization inside the collecting duct, and the lymphocytic infiltration was also prominent in the renal parenchyma, along with the tubular desquamation and degeneration, indicating the subacute to chronic nephritis. And in jejunum, there was severe submucosal congestion and lymphocytic infiltration. Jejunum showed denudation of peptic enterocyte and lymphocytic infiltration, indicating enteritis. So now, based upon the pathomorphological examination, the diagnosis was found to be subacute severe diffuse serofibrinous pneumonia, chronic multifocal hepatitis along with bile duct hyperplasia, subacute enteritis and nephritis, and the tentative diagnosis was serofibrinous pneumonia and hydatidosis. And the urine examination revealed multiple triple phosphate crystal that were present in the abundant RBCs. They were present in the urine examination, and on bacteriological examination, no bacteria was isolated. It might be due to the antibiotic therapy that was given to the animal. So the disease condition was finally diagnosed to be serofibrinous pneumonia and hydatidosis, and the etiology was most probably the viral infection and ultimately the stress. Now coming on to the discussion. So the wound infection, it lead to the direct invasion of the bacteria, and it could also lead to the recumbency of the animal that lead to the anorexia, starvation and dehydration, and make the urine more concentrated and acidic that already precipitated the calculi. The calculi might have started to form months ago, but it exaggerated the formation of the calculi and lead to the nephritis also. So the hydatidosis, they are commonly taken up by eating the contaminated food or feces of the through the metacystode of the Echinococcus species, and that lead to the severe hepatic insufficiency or hepatitis and lead to the biliary cirrhosis in the chronic infection. And since the animal was anorectic and wound was also there, it lead to the stress that lead to the stress always leads to the immunocompromisation, and bacteria, they are always present in the gut flora. So these bacteria, they might cause the secondary infection, and along with the virus that are also commensal and are present ubiquitously in the environment, they lead to the pneumonia, and this pneumonia lead to the pressure on the heart that might lead to the rounding of the heart, and the pneumonia also lead to the dyspnea and the hypoxia, and all these pneumonia, dyspnea, rounding of the heart, it lead to the severe cardiovascular insufficiency, and also the starvation and the dehydration leads to the cardiovascular insufficiency that ultimately leads to the death of the animal. And it provides a unique insight how a simple wound can lead to the so much of the stress and can lead to the subacute death of the animal in the heart. So these are my references. Thank you so much.